Bone grafting plays a crucial role in the field of implant dentistry, serving as the foundation upon which successful dental implants are built. Whether a patient has experienced bone loss due to periodontal disease, injury, or other factors, bone grafting can be a necessary step in the implant process to ensure a stable and long-lasting result. What is bone grafting? Bone grafting is a surgical procedure that involves adding bone tissue to an area of the jaw where bone loss has occurred. This new bone tissue can be taken from the patient's own body, autograft, or from a donor source, allograft or xenograft. The purpose of bone grafting is to create a stable and secure foundation for dental implants to be placed. Why is bone grafting necessary in implant dentistry? In order for dental implants to be successful, they need to be anchored into a strong and healthy jawbone. If a patient has experienced bone loss either due to periodontal disease, trauma, or other causes, they may not have enough bone tissue to support an implant. In these cases, bone grafting is necessary to rebuild the bone structure and ensure that the implant has a stable foundation. Types of bone grafting procedures. There are several different types of bone grafting procedures that can be used in implant dentistry, depending on the extent of bone loss and the patient's individual needs. Some common types of bone grafting procedures include 1. Socket grafting. This type of bone grafting is performed at the time of tooth extraction to preserve the bone structure and prepare the socket for future implant placement. 2. Ridge augmentation. This procedure involves adding bone tissue to the ridge of the jawbone to create a more stable foundation for dental implants. 3. Sinus lift. This procedure is often necessary for patients who need implants in the upper back jaw, where the bone is naturally thinner. A sinus lift involves adding bone tissue to the sinus cavity to create more space for the implants. 4. Block grafting. In cases of severe bone loss, a block graft may be necessary to rebuild a large area of the jawbone before implant placement. The bone grafting process. The bone grafting process typically begins with a consultation with a dentist or oral surgeon who will assess the patient's bone density and determine the best course of action. If bone grafting is deemed necessary, the procedure will be scheduled and performed under local or general anesthesia. During the procedure, the dentist or oral surgeon will make an incision in the gum tissue and place the bone graft material into the area of bone loss. The graft material may be covered with a membrane to protect it and promote healing. Over time, the patient's body will naturally integrate the new bone tissue into the existing jawbone, creating a strong and stable foundation for implants. Recovery and aftercare. After the bone grafting procedure, patients will need to follow specific aftercare instructions to promote healing and reduce the risk of complications. This may include taking prescribed medications, avoiding strenuous activities, and following a soft diet for a period of time. Once the bone graft has fully healed, the patient can proceed with dental implant placement. The success of the implants will depend on the quality and density of the newly grafted bone, so it is essential to follow all aftercare instructions carefully. Bone grafting plays a vital role in the success of dental implants by providing a strong and stable foundation for the implants to be placed. By understanding the different types of bone grafting procedures and following a comprehensive aftercare plan, patients can achieve long-lasting results and restore their smiles with confidence.